question from social media platforms. This lady here wrote and said that she had an FUE transplant a little while ago, about a year or so ago, and she's asking if the results here are going to get better. She's happy with the results on the temples, but is concerned about these little areas here in the frontal hairline, and she's asking if PRP might be a good option or if she should expect more growth. She's not my patient, so obviously take this with a grain of salt because, again, I didn't do the surgery, but she did provide some pictures that are interesting to see of her immediate post-op. So just looking here, I can see that the sides here, the temporals, have been packed a little tighter. The grafts have been placed a little closer together. And along the front here, there are some areas where there's less density. So it doesn't really surprise me that the result post-op shows these little areas. Overall, I think this is a good result for what it is, right? So my answer to her, if she was my patient, would be, well, we can add some more grafts in here and bridge those gaps and then, make sure that those hairs are growing. I believe that the temples here, everything that was placed grew. It's just a matter of a little bit less density during the procedure in those areas. PRP, that's a matter for another video entirely because I have my personal opinions on PRP. I don't believe that it does much for hair loss, although it's controversial. There's opinions either way, and that's okay. But I don't believe that these situations will be improved with PRP. You need to have more grafts placed in those areas so the density can match what's around it. So if you're facing a similar situation out there, I would recommend talking to your surgeon, the person that did the procedure for you. Obviously, that's the best thing. If not, I'm here for you to help you out too. Thanks.